record surge that we're seeing is going to start declining here pretty soon. We seem to be at a plateau, and Dr. Hartledge is going to be talking more about that with a slight decline, but we've got to be humble to this virus. We have certainly learned that over the years, and we never want to forget that. And with the raw numbers we're seeing right now, we've got to be humble to it. We're approaching 500 hospitalized. Hopefully, we won't reach that, but we've certainly are over 400 for the past several days or so. So we've got to continue to do the best we can as a community to keep the pressure off of our healthcare system so people that have real and immediate needs can have capacity in the hospitals, and also give our healthcare workers a break. I mean, it has been very, very difficult on them throughout these 2 years or so. And of course, we want to keep JCPS back in session as well. They were out for 2 weeks. They started back yesterday. We want to make sure that we can keep our kids in our schools. Now, the global scientific community amongst all this is learning a lot more about Omicron, how it's out there. And as we've long hoped and suspected, the vaccines are working. That's just undeniable science now. So late last week, the CDC reported that Moderna and Pfizer boosters were 90% effective at averting hospitalization. So some people say, look, people that have been boosted are in the hospital, why bother? Well, because your odds for going to the hospital go way down, and the folks that are in the hospital typically have some type of underlying conditions as well. So if you can get your two vaccines and then boosted, get your 3 shots, you've got an outstanding chance of not contributing to the burden of our healthcare system, not to mention spreading on the virus to families and other loved ones. As everybody should know by now, the first and second doses and boosters are free, and they are widely available throughout the city at more than 100 locations. Here's a screenshot giving details on that. And our public health team continues to set up mobile clinics in neighborhoods where accessing shots might be particularly challenging. So access and availability are not issues. If you know of anywhere that you feel like it is, please let us know, and we will solve that problem for you. Now, we got to also remember that only 63% of the community has had 2 shots. So we still got a ways to go in terms of everybody getting boosted in the community and getting vaccinated. So with everything, with these shots so available and so easy, the question is, why risk it? Go ahead and get your shots. We are seeing people still, first time folks getting their shots, like to get it more quickly. So if you're thinking, well, nobody's getting first shots anymore, that's just wrong. So we're getting first shots, second shots, and boosted, and we can see that on our dashboard. Now, another key action that we're taking outside of vaccines is obviously testing. I was glad this past Friday to be able to announce the launching of a new free testing site in West Louisville at St. Stephen Church, and another in Shively at Shively City Hall on Dixie Highway. And my team for years has looked at challenges through an equity lens to make sure that every resident and every part of the community are getting the tools we can provide. And that's been true since COVID-19 arrived in our city nearly 2 years ago. So the West Louisville and Shively sites join the centrally located Churchill Down site that operates 6 days a week. And we're going to be sharing a little more information about a delayed opening tomorrow on that Churchill Downs site. As it relates to tests, the federal government is stepping up even more. So we're pleased that the Biden administration has arranged for free at-home tests to be sent to American households. You can go to covidtest.gov and request the tests that can come directly to, or the tests that can come directly to your home. And this all only works, right, the testing, if we follow isolation guidelines. So we know that might be inconvenient, but we don't want you passing along the virus even further into the community, because we've had a heck of a problem with that with this infectious Omicron, and we're hoping that we're seeing a slight decline now. And then, of course, no press conference would be complete if we didn't talk about masks, and especially quality masks. So we know that the KN95 mask are certainly better than the cloth mask, the surgical mask, et cetera. So the cloth mask is better than nothing, but try to increase the quality of your mask as you're out there, and please wear that when you're going inside in public environments like the grocery store, the pharmacy, if you go to a ball game, that type of stuff. All right. Okay, in a moment, we're going to hear from Dr. Sarah Moyer, Chief Health Strategist and Director of Public Health and Wellness, about the impact the virus is having on childcare. The return to work numbers for women have been really tough. Women have really sacrificed more than what they should have during this pandemic in terms of getting back into the workforce, and childcare is a big part of that. We're also going to hear from an expert from U of L Health about the protection vaccines offer pregnant women and the vaccine hesitancy that's being seen with some expecting mothers and those trying to become pregnant. So first, we're going to hear from Dr. Sarah Beth Hartledge. She's our Associate Medical Director, and she is going to talk about the data. Doc, what's going on?
Yeah, thank you. So we're having a little bit of a rosier perspective this week. Our numbers are still very high, and if they were this high a year ago or any time in the past, it would have been quite frightening. But last week we logged over 16,000 new cases, and in the past 7 days we've had about 14,000. So then it does appear that we've crested the case count wave for this Omicron variant. And we're currently sitting with a case incidence rate or a case rate of 265 cases per 100,000 of the population. And as a reminder, that is still 10 times the red level, which is 25. You can see the very abrupt rise in cases here in the last 6 weeks or so around the holidays and into January. It does look like we have crested that wave, and the cases are beginning to come down. But as I said last week, the nature of statistics is that there are just as many cases on the back side of the curve as there were on the front side of the curve. So we are still in for quite a few more cases to be collected over the coming weeks. And our death numbers, thankfully, have not risen at this point. We do know that many people have a milder case with the Omicron variant, but certainly not everyone, and we are still seeing a large number of patients hospitalized. We take a look at our vaccine data. We're at 63.5% of our population who have completed their 2-dose series. About 74% have received at least 1 dose. I am happy to see our booster numbers have come up some. We've at 42.8% of people over 200,000 folks have gotten that booster dose, which is great. We saw several months ago the data out of Israel said that getting that booster would really help cement your protection against severe disease, hospitalization, ventilator use, and death. And we have now seen that borne out here in the United States. So great to see people getting their boosters. We are still looking at a large number of hospitalized patients. Even if Omicron is a milder infection for most folks, the fact that we have had so many infections over the past few weeks just suggests that even if a very small percentage of folks need to be hospitalized, it can still place a significant strain on our healthcare system. So we're at about 490 hospitalized right now, and about 80 folks in the ICU. And those have held for the last few days. So hopefully we won't see an immense rise on that. And likewise, the ventilator numbers have held pretty solidly for the past few days, 52 yesterday, around 50 for the past several days. So we are still 10 times the red limit, and it is that way across the entire county, every zip code, every corner of every little pocket you look into. So it is still everywhere. And as you said, the layered protections are the best way. Boosters are available in hundreds of places across the city. So if you've not gotten yours yet, please go out and get it. And maybe we can weather the last of this Omicron surge over the coming weeks.
All right, let's hope so. Okay, let's bring in Dr. Moore now. She's going to talk about child care guidelines and serious impacts of the virus on family life as a mother of 4 beautiful children. She is living that as well as part of her leadership with our public health department. So, Dr. Moyer, what's going on with daycare and what's the city facing right now?
Thanks, Mayor. Appreciate the opportunity to talk about what's going on with our daycare population as well as parents of those of kids of 0 to 4. As we've seen with vaccines roll out, the pandemic people have been able to get back to some of their pre-pandemic lives with vaccination, just adding masks and testing, except for two big groups are immune compromised, and then those that are 0 to 4 that still do not qualify for vaccination. This has been especially hard on parents who have kids in daycare. We have seen I'll go over the new daycare guidance here in a minute, while it has relaxed some following the general public relaxation of some of the guidance with quarantine and isolation, it still is pretty strict with just because our kids cannot get vaccinated. And so you and I, since we are boosted, if we get exposed, we're still allowed to be out in the community with a mask on. That's not the case for our 0 to 4. So a lot of quarantines are happening, a lot of isolation. And that's causing a lot of strain, especially on our parents 0 to 4. They've had to be out of work multiple times just in this last month with case counts increasing. So I think what led to the new guidance is just like the updates with the general public. More people are vaccinated in our community and boosted, and we're seeing milder infections with Omicron, especially for people that are vaccinated or have had COVID previously. And so able to shorten the guidelines a little bit because we've seen that it's been safer, especially with mask use. So with the changes, isolation has changed. So instead of kids being out for 10 days, if they are over 2 and are able to wear a mask consistently indoors, those who have symptoms improving can return on day 5, or after 5 days at home can return on day 6 if they can wear that mask consistently inside. A lot of daycares, because of staffing shortages and other issues, may not feel comfortable with that consistent mask use or still are using that 10 full days for isolation. And then same with quarantine as well. It used to be 14 days every time a kid in the class was exposed to somebody with COVID. We are able to shorten that to 10 days and then even 5 days if they're able to wear a mask for the rest of the 10 days in the daycare. So, but unfortunately, a lot of daycares are choosing that 10 days still. And so I think the big thing I just want to make sure public, employers, everybody is aware, with the huge increase in cases in our community, there are a lot more cases in our daycares, not because of it spreading in the daycare, but because people are exposed and are bringing it in, and that's caused multiple quarantines for parents. I know parents who've had kids haven't been in daycare at all in the month of January because there's consistently somebody that they're exposed to and then have to go back home. And a lot of people still only have 10 days of vacation or sick leave, and so that's already been used up in the month of January. So just want to make sure everyone's aware of the struggles, the parents out there, we get it, and just a huge shout out to our daycare personnel, our daycare staff. A lot of appreciation for our medical staff that has come up, but our daycare staff have put themselves out there, are protecting our kids, and are working really hard to try to make sure our parents can continue to work.
All right, thank you, Dr. Moyer. Anything from your heart as a mother of 4 to fellow parents out there?
I mean, it's hard right now, and I know that our daycare staff are trying their hardest. I think most importantly, to protect your kids, protect the other kids in the daycare with you, make sure everybody else around them is vaccinated. And so anyone over the age of 5, other siblings, please make sure they are vaccinated, as well as parents, grandparents. Just like how when you pre-COVID, when we had a newborn baby, you wanted to make sure everybody who came to visit had a flu shot or their tetanus shot, pertussis shot. COVID shot is just as important right now. And I know hopefully Dr. Miller will touch on this. The most important thing to do for that first year is make sure you get vaccinated when you are pregnant for COVID. That is what's going to protect your newborn the most. And I'll let him go into, I know there's some concerns about fertility. No study has shown that, and so hopefully he will touch on that as well. So vaccinate and everybody around them, that'll help protect it. We've got a lot of data to show that that's probably the best thing you could do. I know for my kids' daycare and a lot, our case counts across the city at daycares dropped a lot in March after staff were able to be vaccinated. And they stayed pretty low until this Omicron surge. And so just with more COVID in the community, making sure your staff is boosted, that will help a lot as well too.
Great, thank you. And just another reminder to people when they're visiting our little citizens out there, it could be a aunt or an uncle or somebody that for whatever reason hadn't got the shot yet, and you might be asymptomatic and you might think you're bulletproof, but you're passing it along to the youngest kids too in the community and impacting our whole daycare situation. So we're all connected, right? And everybody needs to do their part to get their vaccines and get boosted. Now let's talk about an area that has been concerning, and that is all the disinformation that has been spread over the internet about the impact to women that are pregnant or trying to get pregnant on as it relates to the vaccine. That's been really distressing and caused a lot of mental health concerns about women that are in this category in our community and those that love them as well. But once again, we've got to follow the science, and there's good science around all this. So really happy to have Dr. Edward Miller join us this morning. He is the maternal fetal medicine physician and high-risk pregnancy obstetrician with the University of Louisville Health. So Dr. Miller, thank you for joining us today. And why don't we start off by you sharing the work with us? What is it that exactly you do? You've got a lot of multisyllabic descriptions of your profession. So what's it all mean?
It is definitely a mouthful. So, as a maternal fetal medicine specialist, I specialize in high risk obstetrics. So, the care for mothers and babies that have complications. So, for all of our moms, that would mean that you have a COVID infection that is severe enough that requires you to be hospitalized, or a lot of other conditions like hypertension or diabetes. I also care for sick babies, so babies that have been diagnosed with a problem on ultrasound, babies that are having problems growing inside of the mom, and then finally on moms who have a history of possibly conditions like lupus or all kinds of things. So it is a pretty broad job, but it allows me to take great care of families, both moms and babies.
Well, thank you for doing that. I know there's a lot of highs and lows in the work that you do, but we need you right there on those front lines. So thank you for that. Let's talk about COVID, and you can maybe start from the beginning and go all the way through Omicron, but how has it been affecting your patients?
So, in the beginning, there was so much unknown, there was so much fear amongst patients, and we saw that our phone lines were getting overwhelmed. Our triage units the hospital were getting overwhelmed. And then there was this evolution of the vaccine on the horizon, and there was then the questions of is this vaccine safe? And the biggest concern at that time was is that while the vaccine had great efficacy and great data that applied to individuals. None of those individuals were pregnant because pregnant women weren't in those initial studies. So we saw that pregnant women were intrigued by the vaccine, but had so much concern over whether this was safe, not only for this pregnancy, but also for their future fertility. The big elephant in the room, I think, is this going to have long-term impacts on how my baby develops? And the hard part is that a lot of things we can't tell you. We can't, parents are concerned about is there a link to autism with the vaccine? Is there going to be developmental problems with vaccine and things that won't be present at time of birth? And then as the vaccine became more widely available and more well publicized, and we started getting pregnancy data, we saw kind of a sigh of relief. And I think we saw numbers decline and we saw less pregnant women in the ICU and less preterm delivery. And now with Omicron, we're slowly seeing this come back. We're seeing the phone calls come more frequently. The triage units are now uh, so almost getting overwhelmed, and we're seeing that we're having more COVID positive patients on the unit on a daily basis on labor and delivery. And those COVID positive patients kind of spread the gamut. Some women that are just come in feeling great, test positive, and some women that are in the ICU.
Yeah. So when you're seeing that, when it comes to positive cases, how are your vaccinated patients doing compared to unvaccinated patients?
So the U of L, consistent with national data, what we found is that while pregnant women are not more likely to contract COVID. When they do, if they are unvaccinated, they are more likely to contract severe COVID. So by that, we mean that they are more likely to require oxygen. They're more likely to require mechanical intubation or ventilation. They're more likely to have preterm birth. And it makes a lot of sense. So COVID infection can cause pretty severe pneumonia. And during pregnancy, just the physiology of the growing uterus and the growing baby, those lungs just can't expand like a non-pregnant person's can. So as a result, we see that pregnant women come in, their work of breathing when they have severe infection is worse. And oftentimes the hardest part about managing COVID in pregnancy is you hit this point where the very pregnancy is preventing a woman from recovering from this infection. So we are having to deliver babies early because that physiological change of the pregnant belly is preventing women from recovering. And then after delivery, women oftentimes make pretty quick recovery from COVID infection. However, you have the sequela of a preterm baby that's in the NICU, of a mom that's separated from her child for weeks to months. So it's a very, very difficult conversation. And the best thing to do is to have the conversation with your obstetrician or maternal fetal medicine specialist at the beginning of your prenatal care. And as Dr. Boyer alluded to, if you're not vaccinated yet, the best thing you can actually do is get vaccinated during pregnancy because there's great data that it's safest for you and that has the best benefit for baby.
So that's no matter where you're at in your pregnancy. You could, if you don't have it and you're going to deliver in 2 weeks, go ahead and get vaccinated then.
Absolutely.
Yeah. Okay. So what I'm hearing you say is that non-vaccinated pregnant women are having more issues in the hospital than just the general population.
Absolutely. So we have had women that are vaccinated that have come in sick and haven't been admitted, but we have not had a woman vaccinated that has been in the ICU or mechanically ventilated during pregnancy that has been vaccinated. So all of our patients that have been mechanically ventilated, that have been in the ICU because of COVID infection that are pregnant, have been unvaccinated.
Okay. And then what about the fertility concerns that you see on our friend the internet? What do we know about that?
So there's actually some really great recent articles and recent data that came out about fertility concerns during pregnancy. What we found is that there are absolutely no fertility related concerns to this vaccine. And actually, conversely, one of the studies found that the only fertility related change was in men who had contracted COVID-19 infection 60 days prior to a woman's menstrual cycle. We know that COVID can cause really overwhelming fever, high fever, and that can affect a male's sperm count. So it can actually decrease their chances of conception. But the studies that looked at over 2,000 couples that were trying to conceive showed that vaccination within 60 days prior had no changes to their ability to conceive, and only COVID infection in males had a change in fertility rates.
Good. Well, this disinformation can really be harmful. I was talking with somebody who knew somebody that whose 16-year-old daughter, 18-year-old daughter was very concerned about getting vaccinated because she didn't want to have future fertility issues. So this was in her head and just kept going around and around. And fortunately, she's fine. But it's the kind of misinformation, disinformation that's really harmful. So I really appreciate you sharing these facts with us. And is there anything else you'd like to share here while we're on the line?
I would just say that the decision to become vaccinated is, of course, a personal one. And I hope that you have a provider that you can discuss vaccination with, your concerns and your fears and hesitancies, and that you can come to the decision that's best for you and your family. I will say that in my experience, the decision to receive a vaccination is an easier conversation than the decision to be intubated or receive life-saving alternate therapies that we use for severe COVID infection. And in all my patients where I've had to have that conversation, there's definitely been a wish that they could have had this conversation and this vaccination decision earlier in the pregnancy. And if you choose not to become vaccinated, as Dr. Moyer said, there are other things that you can do, wearing a mask, good hand hygiene, and like we talked about, making sure that everyone around your newborn, everyone around you during your pregnancy is vaccinated, boosted, and practicing those same safe measures as you are.
Good. Well, thank you, Dr. Miller. You might want to hang with us for some media questions, but appreciate you helping us today. All right, with that, Kathy, let's go back to the media questions.
Okay, thanks, Mayor. A lot of questions today. Our first one is from Gabrielle Harmon with WHAS 11. With the FDA recently announcing 2 monoclonal antibody therapies off the list of COVID-19 treatments for now, because of them not working against the current variant, will this affect us and how we treat the virus here in Jefferson County? So I will turn over to any of my doctors, maybe Dr. Hartledge. You want to address that?
Yeah, Gabrielle, you're correct that there are 3 monoclonal antibodies on the market, but 2 of them are thought to not be effective against the Omicron variant. Sotrovimab is the last man standing there. And that has affected how the virus is treated locally because it is in more limited supply when there's only one effective choice. So that has been a change we've seen, but I believe that that change had sort of already been made on the ground prior to the FDA's announcement. So sotrovimab is the monoclonal that works against Omicron. It's being given mostly for high-risk folks. Pregnant patients would be one of those. And then there are also the PO treatments, the molnupiravir and Paxlovid, which also have recently gotten EUA approval. And both of those also remain in short supply. So treatments after you get infected, as far as specific treatments like that, can be in very limited supply right now because of the limitations in what's available and the manufacturing needing to catch up a little bit.
Okay, thank you. Also, Dr. Hartledge, here's a question for you from Lexi Ratterman of WDRB. In your opinion, when could we move into an endemic?
That is a very big question, Lexi, but I think what we can say for sure is that everyone who follows these things believes that COVID will eventually transition to an endemic versus the current pandemic. An endemic virus is something that is consistently present in a relatively low level in certain areas. So the flu is an endemic virus. Malaria in parts of Africa is an endemic disease. So we are familiar with dealing with endemic viruses and diseases. They can pop up from time to time and have little peaks, little surges, but in general, they have kind of a consistent background rate. And maintaining that consistent background rate requires the replication number to be much lower than what we're seeing right now with Omicron. Generally, we would want to see that R number around 1, and for Omicron, it's 4 or more. And what that means is that one person who's infected, if the R number is 1, one person who's infected infects one person. So it's not going to be that exponential spread, the giant spike like we've seen recently. I think every time we have a wave, someone gets on TV and says that it's the last wave and that we're about to transition to endemic. So I will leave the soothsaying to those folks and say that the presence of or the occurrence of multiple variants and continued development of variants is likely to prolong that timeline. And because of that, the emphasis really needs to be on global vaccine equity because we have billions of vaccinated people on the planet, but we also have billions of unvaccinated people, and those folks can serve as a reservoir to create additional variants. So are we going to be endemic? Probably yes. And I believe that the more variants we have, the longer that timeline gets. And global vaccine equity is a path to helping make that transition.
Thank you, Dr. Hartledge. Dr. Moyer, this question is for you from Lexi Ratterman with WDRB. JCPS says they keep in constant talks with medical experts to help determine in-person or virtual learning. What can schools expect in the coming weeks with Omicron? What have you advised?
So our team meets weekly with JCPS, just going over cases and staff and students, numbers that are out, quarantine, isolation that needs to be happening. I think the last 2 weeks they've had to close because of staffing issues. Hopefully with numbers trending down, them being open this week is a good sign, and I'm hopeful that that'll be able to continue in the weeks to come.
Thank you. This question is from Sarah Ladd. Dr. Hartledge, I'll address this to you. Have we seen any evidence of the Omicron BA2 in Louisville?
So Omicron is a variant of COVID, and there are actually 3 sub-variants of Omicron. So it's a bit of a messy family tree at this point. BA1 has been the dominant Omicron here in the United States. We have seen recently in Europe that BA2 is causing some problems, most notably in Denmark, and they're beginning to see it in the United Kingdom as well. In Denmark, 65% of their cases this week have been BA2. BA2 continues to appear fairly mild compared to Delta, but it is even more transmissible than BA1, which is a little difficult to swallow, but it is even more transmissible. And so they're having sort of a second wave of Omicron right now in parts of Europe. One special thing about BA2 is that the flag that we use to test samples for Omicron is not included in BA2. So it's a little more difficult to identify it in viral samples unless you have full sequencing. So our wastewater samples do undergo full sequencing, and we have seen BA2 in the wastewater. We have not yet seen BA2 reported in human cases, but that may be an artifact of the testing. So we probably have some here. We have not seen a particular spike associated with it, but it is happening in Europe, and we know, in the past that we've followed their lead a few weeks later. So it's definitely something that we're keeping an eye on locally.
Okay, thank you. This question is from Sean Bowdy with Wave. There have been some healthcare providers across the country now reportedly billing patients for a COVID vaccine or booster. Is the federal government still covering costs? Are Louisville healthcare providers billing patients for vaccines? Dr. Moyer or Dr. Hartledge, either one of you can address that.
Dr. Hartledge just talked a lot. I guess I'll take it. The vaccine should have no out-of-pocket costs. So I do not know of any place locally, but recommend reaching out to our hospital partners. I know we do not charge for the vaccine. And same with testing as well too. There could be some out-of-pocket costs for testing. Any of the sites that we've set up, though, we've figured out ways to get around that. So if you're concerned about out-of-pocket costs, please make sure you're heading to one of the health department or the Churchill site for testing.
Okay, thank you. This question is from Paul Miles of WHAS Radio. Dr. Hartledge, you may have already addressed this, but what is the explanation for the spike in ICU cases on Sunday, January 131? Sorry, I was reading that wrong. The 131 in ICU on Sunday. Can you explain that?
Paul, I'm very happy to say that I believe this one to be a good old-fashioned typo. We're confirming and reconciling that data, but we have one facility in particular that reported 11 cases on Saturday and 11 ICU cases on Monday, but they reported 61 cases on Sunday. So I believe that it was likely a typo. We're confirming that, and I believe the actual number to be more in line with the 70-ish total that we've been seeing.
Okay, thank you. Dr. Moyer, Paul has a follow-up question that they're getting a lot of inquiries from listeners about where they can find N95 masks. Do you have any suggestions? And I think also we've had a lot of requests of the federal government will be distributing free ones. Do we have any information on that?
So first, I don't have details about the federal program yet. I'm hoping that I think I heard rumors they're coming to pharmacies, maybe the state. As soon as we have more information about that, we will share that. To get one yourself, I know places like Amazon are selling them. You can order them, as well as a lot of the construction type stores. It might be a good place to look as well to Home Depot, Lowe's. There are similar masks that are used at construction sites. So keep a lookout, and again, the best mask you can find. So if you can't find N95, wearing a surgical mask or double masking like we did about a year ago is also highly effective.
Okay, thank you. This question is from April Rickert with WFPL. And Dr. Miller, I will address this one to you. How does the severity and illness among unvaccinated pregnant women compare with serious illness in unvaccinated older people or those with comorbidities?
So I think that, the elderly population are at increased risk of having a lot of healthcare comorbidities like high blood pressure, diabetes, or chronic lung disease. And I think it's actually probably pretty similar in terms of the fact that they're both considered in the severe population or the high risk group. So you're going to see, like I mentioned before, just an increased incidence of more severe respiratory disease and possibly in the ICU or to be intubated.
Okay, thank you. And then a follow-up question from April for Dr. Moyer or Dr. Hartledge. Have you heard anything about a delay in testing results at the Churchill Downs site? Yeah, I don't believe we are aware of any delays, April. I think I would add what we have said before, that the severe weather as well as Omicron spread has affected some of our testing providers who, like many people, are having staffing challenges. So again, we just direct people to look at the many different testing sites on our website and just ask for maybe a little bit of patience and grace for those testing providers. And also maybe call or check their websites before heading out. And as Kristen noted in the chat, we do know that the Churchill Downs site is going to only operate from 1 to 5 tomorrow due to some weather delays or weather-related issues. Sarah Ladd is asking what the city's positivity rate is right now. Dr. Hartledge, do you have that?
Yes. Our positivity rate is about 32% right now. And that is across the board. We have definitely seen sites with higher positivity rate than that. Churchill Downs has been seeing around 40%. And specific events in outbreak locations have been higher than 50%. So just the high positivity rate continues to confirm for us that even though we're seeing very, very high numbers of cases, that there are likely even more cases out there sort of in the wild that we're not actually being able to capture in the reporting. So the positivity rate remains above 30%, which is very high.
Okay, thank you. And thank you, Tara, for noting that the 502 live streamers are having Dr. Hartledge and several other health experts on tonight for a live stream at 8. And then Tara had a follow-up question. Dr. Hartledge, can you explain the working relationship we have with, as far as testing goes, with independent contractor testing sites, and whether the city has control over their hours of operation or available staffing?
We do not have control over their hours of operation or their available staffing. Independent contractors have certain licensure requirements, which are generally administered at the state level. We typically serve as just a connector for them, so helping to point them to areas of need and perhaps assisting with resources for setup and things like that. The KNA team does operate a little bit in more direct partnership with us in certain areas, but as far as the folks like Blue Water, who's operating Churchill Downs site and things like that, they are responsible for their own management and staffing. And as Kathy mentioned, just like every other business out there, they have had staffing shortages associated with COVID outages, and then of course they're working outside, so they have weather associated outages as well.
Okay, and Tara had another question. The Kentucky Nurses Association, shout out to Delanor's amazing crew, has a lot of testing going on by our incredible nurses. How are those sites testing and vaccine clinics being promoted?
We do maintain a list on our website, and then also promote specific events on social media as well. We often partner with community groups to make sure that they reach into their networks We've had a lot of great experiences, for example, with La Casita Center, who helps direct folks to events where vaccination or testing, depending on the goal, is available. So we continue to operate those things with announcements on social media and on our static website as well.
Okay, thank you. One more question from Tara and then one from social media, and that's it for our questions for today. So Tara's last question is, Dr. Hartledge, I think I've heard you explain this before too. Can you address the specific home test effectively or not effectively detecting Omicron? She took 4 quick beauty tests while positive by PCR, and all of her home tests were negative. Can you help explain that?
I can try. The home tests are less accurate regarding the Omicron variant than they are regarding Delta or previous waves that we've experienced. So for most people, testing later in the course, so traditionally we would recommend day 2 to 3, and with Omicron, we've been recommending day 3 to 5. For most people, they do see a conversion to positive later in the course. I will add that the BA2 variant has it also eludes testing in a different way. So I don't know, Tara, maybe you were our first BA2 human case and we just didn't know. But in general, the repeated home testing at a later date for many people does improve the accuracy. And we also see an improved accuracy when the test is collected by a healthcare worker. So when one of our KNA nurses does the swab in your nose, maybe they swab a little more aggressively than you would do on your own, but the testing when it's done by a healthcare worker, even if it's the same test, is typically more reliable. As I said, it's not a perfect test for Omicron, and PCR is certainly the gold standard for any variant. And I'm happy that you're feeling better and back with us today, Tara.
Thank you. And then our last question is from social media. Is there a website where people using at-home tests can report their COVID positivity results? I don't believe we are aware of any such thing. Dr. Moyer, Dr. Hartledge, are you aware of any site where people can report their home positive results?
I can take that. So no, we're not asking people to report their home positive tests. Our positivity rate is just PCR, and we've done that to be consistent with the state and federal partners. And so reporting that won't change the positivity rate that we are reporting out. If you do have questions, if you test positive, just encourage you to call our helpline at 502-912-8598. We are more than happy to go over the guidelines with you, make sure you have the resources you need to stay home. And so I encourage you to call that number just if you have questions, but otherwise, if you are an expert in the guidance, stay home for those 5 to 10 days, take care of yourself, and hope you get better soon.
Thank you, and Mayor Fisher, that's all our questions.
Okay, thanks so much, Kathy. Well, I want to thank the media for continuing the coverage. The virus, helping us get the word out about how to get through this time here. It's been 2 years, which is kind of incredible. I want to thank our medical team, thank our public health and wellness team. So Dr. Moyers and Hartledge, thank you all for your leadership. And Dr. Edward Miller, very good information today. Really appreciate the good job you do every day in our community, but coming on board here today and helping us out. So with that, everybody have a safe week. We'll be back on next Tuesday, and hopefully we'll see a nice decline in the virus. In the meantime, mask up, get your shots if you haven't gotten them yet. Thank you. Bye-bye.